Close to 30 years ago, quintuplets were born in the city of the hospital where I worked. As the attending on call at the hospital that night, I was summoned to coordinate the management of the new babies, beginning with my presence at the delivery room throughout the baby's prolonged stay in the premature nursery and all the way through their discharge at about 10 weeks of age, with an array of instructions and follow-ups at the outpatient clinic for the first year. As part of Israel's socialized medicine system, part of which is still in place today, well baby care is provided to all babies in the community. Physical measurements, immunizations, feeding guidance, and development follow-ups are all done in clinics located in almost every neighborhood. Understanding how complicated the logistics would be to get even to the corner clinic with the 5 babies, who also had an older sister, and trying to make sure that the well baby care was performed on time, I arranged to make exception and to conduct home visits myself, as well as to have a nurse visit the family periodically to perform all the necessary care for the babies and provide advice for the parents, at least during the baby's first year of life. After the first year elapsed, the mother called me and let me know that they had talked about it and they had decided to continue their care at my afternoon private clinic. When I asked if they were sure that this is what they would like, since there were other, perhaps more convenient possibilities, the woman replied that they were absolutely sure and explained that they had known this for a very long time, since the babies were in the incubators months before. Many healthcare professionals had come in touch with them and treated the babies through very trying times. They had all been very professional and some of them nice and empathic. But as the mother explained, I had been the only one to talk to them about their babies using their names and not referring to them as the quintuplets or the babies. I had made the effort to remember that each of them was a separate individual. As the children grew, the parents began to come for visits and checkups with each of the kids separately. The kids were never dressed in similar outfits. They were encouraged to develop these separate interests, and as hard as it was, they were dedicated one-on-one time. And they were each praised or punished individually. I became a partner in the parents' hard work to establish their children's individual identities. They would forever share a birthday and a very special bond, but they would each have their own thoughts and feelings, likes and dislikes, and I was intent on fostering their individuality from day one. They kept coming to see me throughout the years. I watched them grow and develop and turn into wonderful adults. Our mutual affection grew, and the trust the parents had put on me endured. On occasion, I am still consulted on the health of the next generation, Orly's girls, Tom's twins, or Shai's baby boy.